Alright, hello everyone, welcome back to my YouTube channel. Today I'm going to explain you how to fill up your wound care plan and your wound assessment. Once you did the wound assessment, you will figure out how to do the wound care plan. So today I'm going to give you a quick overview of how to exactly do the wound care plan in a layman's term. Now, so you have all the details that you need to fill out here. As you can see, first name, given name, address, postcode, doctor, date of birth. These stuff you can do by yourself, right? And the second most important thing is wound type. Like, what sort of wound type is it? Is it foot ulcer? Is it surgical pain? Is it burn, traumatic skin tear, pressure injury? What is it that you need to figure out and just make it circle? In my case, it was foot ulcer, so I put foot ulcer and pressure injury, right? And then what are the diseases that a patient is going through? Diabetes, neuropathy, malnutrition. And if it's not in the list, you can write other as well. So it's hypertension because my patient has a lot of has a high blood pressure, which I find out, and that's why I put hypertension there and put the stage of the pressure injury if they have any. Once that is done, this is the most important part that we have to fill up. So put the dates on, location. Where is the location of the pressure injury or ulcer? In my patient, it was right heel, so I put right heel. I put it was a pressure injury on right heel, and I used the scale to measure the diameter and length and breadth of the wound, so it's easier for you to understand that what's the length and breadth of the wound. And the reason that most people ask is, why do we do wound care? Why do we do take the dimension of the wound? I mean, the reason is because you take the dimension of wound today, and the same patient came to you after maybe 5 days or maybe 1 month, and you see a huge distinction on that. If the wound is 1.2 and 1.3, but the next day it is 1.5 and 1.8, what tells you that? That tells you that the wound is getting elongated, that is getting bigger, right? And it's not healing. So that is the main essence of doing the dimension thing. Now, the second thing is you have to do the clinical appearances. So you need to understand this term. What does this mean? Granulating, epithelium, slough, necrotic. Granulating means it's a red blood cell. It's like your wound is healing, but in a red way, in a way where there are a lot of blood coming in. The circulation is healthy, right? And epithelium is it's kind of similar to granulating, but it's pink in color. You see, like when the wound has pinkish on the top of the wound where there is a new skin start to appearing, it's a both healthy thing, but there is a slightly difference between these two. So slough is basically a yellowish part where there is a like chances of bacteria, and it's kind of not good for your wound. Necrotic is a dead cell where its color is black and purple normally, and it's not good as well. So you have to have a look at the wound, and based on your assessment you have to chart it. Let's say in my case, 75% of the wound was granulating and 25% was epithelial. That makes it 100%, so I need to put 100%, right? So exudate is like nail. Sanguineous, so I'll explain what sanguineous means. Sanguineous is basically sanguineous is a red blood cell. It's a if a wound start to appear red and start to have red from their wound, red fluidity it start to come out, then that's sanguineous. But if a wound has white stuff coming out from there, it's like a liquidy white in color, like basically like a water, then that's serous. And putrine is bad for the wound because it's dead white blood cell and it's basically yellow in color. Now, order of the wound, basically it's nil, but some wound does have malor as well, you can put here as well. Now surrounding skin is basically peri skin, that's surrounding your skin. Like what is the, I'll show you right now. So I have a wound here, so this is the whole wound bed, but this is the area that around the wound bed is peri skin, right? So what exactly do you see here? It's all red in color. That means it's erythema, because erythema is inflammation, warm, and it's kind of reddish as well, right? And macerated is when, you know, when you go to the washroom, or when you go to the, it's happening in a shower. So when you shower for a long period of time, or dip your hand in water for a long period of time, you see that what happens in like bubbly in your hand, that's exactly, it's macerated. Now do the pain assessment as well. You can tick it here, put your name in here, and then you are done. All right, perfect. Now thank you for watching this video. I hope you learned something from this video, and maybe I was a little bit fast, but I'll try to overcome that in the next video. And see you in the next video. Thank you.